A COVID-19 task force report posted by the Alberta government is raising eyebrows. It questions vaccines and several other protective measures used during the pandemic. Some doctors are calling the $2 million report anti-science and a threat to public health. Julia Wong reports.
Alberta doctors say a review of how the province responded to the COVID-19 pandemic was a good idea, but they weren't prepared for the report that was released.
The contents are very troubling.
The 269-page report written by Provincial Task Force was led by a doctor who said the pandemic's impact on hospitals was being overblown. The report says there's no evidence continuous masking protects against respiratory illnesses. It supports the use of alternative therapies like ivermectin and says healthcare workers should be allowed to promote the benefits of medications for off-label treatment of illnesses. And it recommends stopping the use of the COVID vaccine without full disclosure of its potential risks and calls for ending its use in children and teens. The Alberta Medical Association says the report misrepresents science.
Many things are simply not what we see in the scientific literature. So we know that the COVID vaccines were very effective and that they saved many, many lives. We know that public health interventions, masking, social distancing, they went a long ways in helping, stem the tide of the virus.
One UCP MLA says he wants the province to act on the report and end mRNA vaccinations for children immediately.
The findings, recommendations of the report are shocking. I think it's up to Cabinet now to follow the leadership of the Premier and activate immediately Dr. Davidson's recommendations.
If the province follows through with the recommendations, Alberta could be going down a scary path, says this doctor.
I'm worried that if there were a new pandemic threat, for example, an avian influenza or a different new coronavirus, heaven forbid, that we would be in a terrible position. I think it would be actively dangerous.
A statement from Alberta's health minister says the province will review the report and says no final policy decisions have been made. Julia Wong, CBC News, Edmonton.
Let's bring in Canada Tonight medical contributor Dr. Samir Gupta. For more on this, Dr. Gupta, I did not read the report. I read the articles in the Edmonton Journal and some other reports on this thing, but let's get your first impression of it.
Yeah, so, as you know, I read it.
Yes, that's why I'm putting that to you.
It was a bit of a gut punch, to be honest. It was, as I'm reading this thing, and it's very slick, it's very well done for the, for the worldview that it's trying to put forward.
As disinformation and misinformation often is.
Yeah. But as I'm reading it, it occurs to me that to the casual reader who doesn't know the evidence, who's not, is not immersed in the science of this and doesn't know the literature behind it, it's actually quite convincing. You might read this report and leave this experience thinking, vaccines weren't effective. Maybe we shouldn't have used vaccines and we shouldn't have had mask mandates or any lockdowns or, all of these measures were not effective. And they do it in clever ways. Sometimes, so I'll read something that is completely false and it won't be cited, so there'll be no evidence behind it. Or sometimes there'll be a citation, so it looks credible, but when you go look at the citation, it actually says the opposite of what they're saying. So they start with their view and they'll cite something that actually says something different, but they'll still go ahead and cite it. And then what they'll do in other cases, they'll be very selective about what they cite. So, in science, we do many studies before we reach a conclusion.
Yes.
So you might have 20 studies and 18 studies say one thing, and maybe 2 studies say something else, and that might be because their methods weren't perfect, or maybe just by chance. And that's just the reality, and that's why we have to repeat studies. So they'll go and cite those 2 studies and focus on those, but they'll talk nothing about the overwhelming data, the other 18 studies. And so again, you have a citation that supports their view. So you might read this and your final conclusion might be that all these doctors and scientists at the World Health Organization, the NIH, Public Health Agency of Canada, your own doctor, these scientists, nobody was right. Everyone was wrong except this handful of people in Alberta who somehow figured it out.
Now the Alberta Medical Association claims the report advances misinformation.
Yes. Yeah.
And I guess that's the problem here. They're worried about the impact a report like this might have on the public. Is that your concern also?
For sure. This is misinformation kills, and that's not hyperbole. Misinformation leads to people making the wrong decisions, understanding risk in the wrong way, and then leading to behaviors that will harm themselves and harm others, and ultimately, in some cases, can actually lead to people dying by making those wrong decisions.
And it felt that during COVID, people were putting some misinformation out there that were leading to people losing their lives.
Misinformation or intentional disinformation.
Yes.
And the challenge with this is that, this is a provincial government of Canada. This is this should be something that most people would think, well, this is going to be credible. There's $2 million. They paid for this report. Their stamp is on it.
It says ivermectin.
That gives a lot of credibility.
And hydroxychloroquine in these reports, and that they work.
The specific examples, there's so many specific examples of how they undermine masking, they undermine vaccines, they undermine lockdowns. And then they talk about things like ivermectin, things that aren't proven. And so it's like the opposite. Everything's sort of the opposite of the scientific consensus.
What's the fear, I guess, of the long-term problems of a report being published like this? When something like this is out there, it validates those views, and very much so because it's from a credible, what should be a credible organization, a government. And so you have, and it feeds into conspiracies. You have people out there who believe that this whole thing was done to control people or to keep them home or to stab them with vaccines or whatever it may be. Well, now you have a government document, several hundred-page document that cost $2 million and has all these citations, seems pretty credible, that validates that view. And so all these people out there who have these views or who are looking for ways to validate that preconceived notion now have this, and it's out there. And that's really dangerous because you don't have these voices at the same time to rebut those views and to talk about, well, here's all the stuff that's missing and here's why it was biased. You don't have that. You just have this report that's out there, and that will make its way on social media now to all of those, down all of those rabbit holes that are there. I know you don't have all the answers, but before I let you go, what can people do to combat this? Like, how do we help, find the right sources, educate ourselves a little better? Yeah, first, I think these conversations are important. Yes. First, this should never happen. Like, we should talk about facts, and you may have a worldview, and we were talking about, if you may disagree with mask mandates, but you can't disagree that masks prevent forward transmission. They reduce the amount of virus coming out, into the air. And it was not perfect. Nobody was saying our response was perfect. Exactly. But we learned so much from it. We could criticize the response. We could criticize, based on your worldview, but you can't really sort of distort the science. You still have to start from a point where you say, here's what the science says, and then what should we have done with that information? What should we have done differently? That's where the debate should be. So that's the first problem. But I think if you're a consumer of information out there, it's all of those safe practices. Where does the information come from? If you're reading something, is the website or the person who's putting this out, do they stand to benefit from convincing you of that worldview? And often there's a monetary benefit that if you're aware of that monetary benefit, then you must take that with a grain of salt. So it's all about, understanding that source, using multiple sources, and using that reliable source. People still trust their family doctor. Survey after survey says that the most trusted person for health information remains the family doctor. That's the person at the center of health decisions for most people. Go back to your family doctor with your concerns and your questions, and that's who's going to help you through it. Maybe that's one of the problems in this province, is that a lot of us are looking for a family doctor. Yeah. Our doctor, Dr. Samir Gupta, is Canada Tonight's medical contributor. Dr. Gupta, important conversation. Thank you. Pleasure.